Hello, everybody. My name is Dr. Amin Abbas, and today we are here for a session on domestic violence. We have a guest speaker over here, and she was just with us a few moments ago, but something happened. I think the connection dropped or whatever. Um, we just lost her. We are just waiting for her, and we want to let you know that the session will start in a few minutes as soon as we have the connection from her side back. So I will request you people to stay online with us as soon as we are able to resume the connection with Professor Tazeen Saeed Ali. Um, yeah, I think she is online with us. Professor Tazeen, we are online. Can you hear me clearly now?
Yes, very clearly.
Okay, thank you very much, and I apologize. I think there was some lapse in the connection, and we can actually start with the session because we are right on time, right? And first of all, I'm really thankful. I welcome all of you who are online with us watching this session live, and I will also be thankful to those who will be watching the recording of this session. Without any further delay, I will start with the introduction of our very senior and worthy guest. Professor Dr. Tazeen Saeed Ali is my teacher, and she's one of those people who has helped me throughout my career. So, her formal introduction is that she is a professor and assistant dean research at Aga Khan University School of Nursing, Karachi, Pakistan. She is a senior research and a postdoctorate fellow at Karolinska Institute. She has completed her master in epidemiology and biostatistics from Aga Khan University and PhD from Karolinska Institute. She has won 20 publications to her credit, which means that she has done a quite amount of research work, and she has earned numerous grants to her credit. She is a senior research trainer and has produced a large number of researchers working on leadership role throughout the world. So once again, Professor Tazeen, I am sure that you have a busy schedule, and I'm really thankful for you to give us time. How are you doing today?
Yeah, very well. It's not that cold today. It's pretty warm here. So
Yeah.
seems like overall people are enjoying outside of their home and all.
Yeah. Okay. So without any further delay, what we are going to do is going to jump directly into the topic. So my first question to you is that because our session is on domestic violence and the research about it. So first of all, what is domestic violence? And can you explain in a way that everyone can understand it?
Okay. That's the best part of it, that explained in a way that everyone can understand. And you
Yeah.
are asking senior faculty who teach all the levels like undergrad, grad, and postgrad, right? Okay,
Yeah, exactly.
yeah. Okay, the simplest way to explain this is that anything which is making anyone uncomfortable, you know, when you kind of you say anything to anybody or you act in a way that someone is feeling uncomfortable with the situation or with the wordings or whatever is happening with them, so that's basically called violence, because someone is you are violating somebody's right, or you are violating somebody comfort zone, then we call it that it's violence. Now, if I have to combine them together and call it domestic violence, so domestic, we all understand that at your home level. So, and then most of the people think that at home level it should be like intimate partners violence, because at home level usually partners are living together. But it is not true in developing countries, as we are discussing about developing countries. So in domestic violence mean, and in developing countries, it's not only intimate partners violence, it's more than that. They people are living together, in-laws living together, sometimes relatives, cousins, far relatives are also living together. So then and then people try to say something, do something, act in a way that others feel uncomfortable. Anyone who is feeling uncomfortable means that person is going through some kind of violence at domestic level, at home level. So that is the simplest way I can explain.
Right. So you said something very interesting, and I want to go deep into that because what you gave an umbrella definition, and I just want to make it clear to our viewers because as a researcher, the concept is clear, crystal clear in our mind. But a few things like, can you go deeper into the types of violence so that it can enhance the clarity of the viewers? Like, okay, from violence, like, okay, what normally comes to the mind of a common man is, or a common person is that, okay, you are hit by somebody, okay, but does is that the only type of violence, or like, can you go into the types of violence?
Sure. I think the best way to understand types of violence to use different frameworks, right? One of the very common framework which a lot of people are using is WHO framework. And WHO framework is highlighting different kind of violences. The most popular violence which WHO is highlighting is the intimate partners violence. It's when any kind of violence being happen like being conducted, or the perpetrator of the violence is basically husband or partner, boyfriend, or anyone with whom a person is in intimate relationship. The another form of violence which WHO is highlighting is interpersonal violence. It's mean the entire family is the one who are creating violence, or who are perpetrating violence, and then they are making others uncomfortable or violating the rights. Third kind of violence, which WHO is very much highlighting, is societal violence. That overall, how men, and it's the men basically who is exposed to societal and street violence, where the men are basically
I think we are having trouble in. I think we lost the connection, and we were having some very interesting discussion with Professor Tazeen related to different types of violence, and I think the video has kind of hung. I'm going to see if you're able to get the connection back again as well. I apologize to the viewers for this. I think that we were having a very good discussion, and Professor Tazeen was telling us about different types of violence, and she was talking about the WHO's framework related to violence. We'll wait for a few minutes and see what happened actually. Or I don't know. In between this and those who, I think we completely lost Professor Tazeen. I think we'll wait for her. And in between the time, we'll take this opportunity to thank once again those who are online. And we'll mention over here that this is supposed to be an interactive session, and you can write your questions in the in the comments, and those will be shown on the screen and will be projected as well. So I'm going to send a message to Professor Tazeen and ask her what happened. Professor, you have, I think we have dropped you. You can again come on the line in the same way as you did previously. I'll be thankful to you. Okay, so I've dropped her a message, and in between the time, whatever time we have to continue the session. We will wait for Professor Tazeen to come back. Let's see how much you can take this opportunity to write any questions from Professor Tazeen, and we will ask her whenever she is back over here. I'm assuming that she will be back immediately. What I'm intending to do is that we are talking about what is violence, what are the different types of violence. I'll be asking her about uh, details about the psychological violence and uh, methodological issues related to research work in violence, and all at the same time, because she's a very senior researcher, she will also be talking about operational issues she faced in her research and what suggestion does she give to different researchers to conduct research in this area. In between this, what I will do right now is I will create a banner over here so that uh, uh, people know that we are waiting for Professor Tazeen right now. Just please bear with me right now. Okay. Okay. So as a reminder, we have just lost a connection with Professor Tazeen. I'm trying to get back to her, and let me give try to See, let me give her a call, uh, see what's happening, and I will request you people please stay online as we get Professor Tazeen back. I think she's trying to get back online. Um, let's see what is happening. Uh, uh, as a reminder, you can ask questions in the comments as well. And this is kind of an awkward situation because at times in Pakistan the internet is not very good. And as a reminder, once again, if you have not subscribed to our channel, please subscribe to our channel and do not forget to press the bell icon. And we do not have any other choice but just to wait for Professor Tazeen so that we can continue with our session. Those of you who are online, I will request you people to stay online till we have Professor Tazeen back with us. Okay, and if you have any questions, if you want to introduce yourself, if you want to talk about anything, if you want us to talk or ask some specific questions from Professor Tazeen, and then you can also put in there. And I think here we
Yeah,
go. Professor Tazeen, are you
exactly.
back? Yeah, I
Yes,
think you're
I
back.
really apologize. I don't know what happened, but some kind of unavoidable situation happened. So I was explaining, I really apologize. I was explaining
No,
the
no, no,
form
no.
of
That
violence,
happens.
and I was saying that WHO is explaining violence in a different sense. But if you pick up the ecological model, which has been picked up by Hayes first time, and then she applied it on the different forms of violence, factors related to violence, and preventive strategy. So then at ecological model, if we just notice, there are different societal norms. So these are basically putting us in different kind of societal violence. Then community, that community is having their own structure, and then this means that community based violence, and then family based violence, individual based violence. Some of the commonest violences people are focusing on is physical violence, psychological violence, sexual violence, emotional violence, controlling violence, economic violence. There are so many, you just name it, and then there are so many different kind of violences going on. So so if we just talk about violence, people often say that it's physical violence. It's not true. It's more than physical violence. Anyone is uncomfortable with any kind of situation, that is basically violence. Yeah.
Right. So I think I want to before I go to the next point. I think you said something which draws a lot of attention for me. First of all, like when we think of violence, then and then the common picture which comes in our mind is that okay, the male is the perpetrator and female is the victim. But you also said that okay, the violence can also be against males as well, which is something very many people do not know that okay, men can also be a victim of violence because male is always taken as a stronger gender and female is taken always as a victim. So can you talk a bit more about this particular aspect?
Interestingly, whenever I talk about intimate partner violence, people often think about violence from male to female. You know, I never say that in my sessions, in my talk, that I am talking about husband's violence. I often talk about partner's violence and intimate relationship violence. It could be between husband and two men. It could be between two men. Men and men are getting married. Women and women are getting married. And then women and men, when they are getting married, it's not only that men is always the perpetrator towards the violence for wife. It could be wife. It could be vice versa. And it has happened. I noticed in one of my study that male also reported that they are going through some kind of severe violence, and and then they are not very much comfortable when their wife is telling them that when their wife is telling them that you have put on the weight and you are someone.
Just a minute. I think you have joined through two devices. I'm
Yeah, my one device is getting closed. Yes.
Okay. I think you can.
Yeah,
Okay,
that
you
would
can
be great.
continue, but your
Because
video is off right now.
okay, okay. Because my device is just got close, so I thought I should connect it from the another one. So
Okay.
that's why I
Okay.
connected
Oh,
there.
oh, but I think that is removed. And whatever you device you were initially talking from, can you continue from that?
Yeah, sure.
Okay. So in between, when Professor Tazeen is again trying to continue, I will. We were talking about. We just started the topic, and we were talking about what is violence. And Professor Tazeen was just because she is an expert. She has done a lot of research on this topic. She was telling us extensively what are different types of violences, um, and through a WHO framework. And following this, we'll ask her what is psychological violence, and then we'll come to the main issue of okay,
Exactly.
okay, okay. Now you
So
can continue.
yeah, exactly. So, what we were at that time, when my device suddenly got closed, I thought I should get connected with another one. This is the beauty of a life, that you could do multiple things, right? So
Yeah.
we all are learning. This is thanks to COVID, that it's giving us benefit of disguise, that we are learning so much of other things and all. Yeah. So we were talking about a little bit on the violence between partners, right? So it could be that, and two of my studies actually been conducted on violence against men, and we were so much surprised to see that a lot of women are telling their husbands that they are not they are not very smart, they are not handsome, they are not very muscular, they are not very macho, and then men feel really really bad with that, that their wife is not very much comfortable. So this is basically a form of sexual violence. So we call it sexual violence when you make others feel about bad about their body. So it's not only that women is the one who is facing a lot of violence, it's men also. On the other hand, we are having a lot of children and adolescents who are facing a lot of different forms of violence, like a peer. We are having peer violence, so then peers are creating violence on each other. We are having collegiate relationship. We ending up as workplace harassment, so that is also a form of violence. And then a lot of parents think that beating the children is absolutely fine in developing countries, but it is one form of violence. And this is also children neglect and child abuse. So one could talk about many many things. Then geriatric population is also, they are usually so much intelligent, experienced, but a lot of youngsters and lot of productive group thinks that they are having old school of thought. So then people try to put them in a, in a shell, in different shell, and then try to put them like, and kind of uh, like put them that where they are no more socializing with the entire world and all. So those kind of things and all, so that is also kind of violence. So when we are saying domestic violence means that we are discussing about the premises within the home, within the home. And then if we are having extended family system, so it's mean that we are talking about child abuse, we are talking about old age violence, we are talking about the adolescence violence, then intimate relationship. Everything covers under interpersonal violence also.
Okay. So next we'll go. You kind of touched on it as well, but can you deep dive into a bit more of psychological violence? Like, because again, when we use the word violence, the common understanding is that okay, if you beat somebody or if you be physically violent, then that is taken as violence. But if I say something which hurts somebody, that is considered kind of a normal phenomenon. So, what do you
Exactly.
think? What will constitute a psychological violence, and especially in this age of technology, where okay, I send a text message to somebody who does not want to receive a text message from me. How do you categorize those things in the framework of violence?
Wonderful. When we talk about different forms of violence, psychological violence is so much common that in most of my researches, I cannot even divide it, my population or my subjects into two. Almost every person reported they are having some kind of psychological violence. you know so then it was so much difficult to come up with the multivariate model. You cannot have multivariate model if your all the participants are saying yes to psychological violence, right? So psychological violence is the commonest one. The most commonest one is psychological violence, followed by physical violence, then at the end it is sexual violence. If you notice that most of the media is picking up sexual and physical violence, they often don't talk about the psychological violence, because somehow psychological violence is becoming such a like a kind of such a normal like custom or normal rules of the entire society. It seems like it is no more violence. It's just the normalization effect is there. So it seems like that everyone can go through with that kind of situation, no problem. Oh, if a daughter is telling a mother, I feel really bad when my entire family, my husband's family, try to show me that I am not intelligent and I am someone who's dumb. So then mother often says, well, it's okay, that's a part of our life. Slowly and steadily they'll understand that you are not dumb, you are a very intelligent person. you know so it's very, very common. A boy comes to a father and tells, you when I go and play my football, I am not that muscular, so sometimes it's very difficult for me to really resist the boys, and it takes some time. So then father often says, "Well, that's okay. It's okay. Let boys bully you, no problem. You build your muscles. As soon as your muscles will be there, they will stop bullying you." So somehow it seems like that all of us have accepted that this is acceptable violence. It's a part of normalization, and no one knows. I often use one example for my students, that if a girl is born, if a boy is born, and you put something in their body, you put something, so they will live with it. They wouldn't know that it is not the part of their body. They would think that, oh, that's too normal. When I was born, it's there, so it's there now. So I have to walk with it. They would never think of taking that out from their body and then have a freedom of life or something like that. So very important thing in psychological violence is that there are some acts, which are very obvious. You know. So for example, telling somebody, "Oh, you look so fat. Look at you. Look at your color. Your color is so pale. Look at your language. You can't speak English. Well, that's too bad and all." So that is some kind of putting somebody down, and all others can observe it is happening. So that is basically called verbal aggression and all, and that's too obvious. So that kind of violence often we pick up when as a researcher. Another kind of violence is basically overt acts, where legal rights are there, like what you talked about, internet stalking, where we do have legal rights and all. That is a form of violence, and then legal rights are there. People could act it. The most troublesome violence is basically it's subtle violence. You know, it's a part of norm. It's a routine. It's fine. We all are wearing these dresses. You should also wear the dresses. See, or we all look same. You should look same. A kind of telling that person, whoever that person is, that you have to act the way society is expecting you to act. If both partners are entering home and one partner need to go to kitchen directly to cook, and another partner do not have to do that, just open the TV and lie down and watch TV. So this is very much acceptable in many developing countries, especially where there are heterosexual relationship, where men and women are together. So women is the one who's taking up the home role, and the man is the one who's also working outside, but after returning of the home, having some kind of relaxation because it is needed for him. So woman is also compatible with that role, men is also, but slowly and steadily with time, this would give more power to one gender, and another gender would start getting drained out, will start thinking that I am not worthy, I'm not important, I am someone who just had to work all the time.
Right.
So that is very dangerous. Yeah.
Right. So in between, as we said, that we can entertain our questions as well. So Mirbas Khan has asked you a question that if Dr. Tazeen can have some reflections about domestic violence in northern areas and how it's different from other parts of Pakistan, how females can access to report such cases with confidentiality. I think this is a very, very important question. So there are two parts. There are two parts to his question. First of all, if how northern areas are different from other parts of the countries. So, and I think the second part is especially important for all the females. And I think I will not say even like you just said that, because violence is not a gender specific issue. So, how to report? I would pose this question this way: how to report violence in a way that confidentiality is maintained. So, how what do you say about this, Professor Tazeen?
Yeah, definitely. First of all, let me just say that this is the biggest challenge in this area, that each and every area is different. First of all, different countries. We have different kind of countries. All countries are different. They all are having their different practices. And then within the country, if we are having different sectors, states, they all are different from each other. And then within the provinces or states, the small cities are different, right? And the situation up in the mountain is much different as comparative to situation lower the sea level, right? People often, sociologists wouldn't like this idea much, but as an epidemiologist and being a nurse with my professional life, I would say that it's not only the society or social sector which is creating violence. So there are many other the lab-based researches is required to be able to understand that, so there are some genetic factors involved in it, right? And that gene is being, it's just coming as his history. Even if it is there even after so many years, and because it is genetic factor, it still stays there. We have some chromosomes present in those people who try to jump from the top, or they try to kill themselves. So then suicide is not only the societal, and also then people try to kill themselves and they are unable to cope with the situation, and then they try to jump. And we often put that in different forms of violence. It could be individual violence, it could be community based violence, it could be societal violence, because of poverty, because of unemployment status. They try to jump and they kill themselves, or they go through different kind of violences, right? We one of the important research is also being conducted in many developing countries, that cadmium is one of the this is element present in water, especially where people are living up in the mountain. That is also creating a lot of mental illnesses, mental issues, and then a lot of people are going through different kind of violences. What happens when a normal person, normal person mean free of any kind of mental illnesses also, is going through any form of violence, and if they have some kind of coping strategies, or if their environment is supportive, so they are able to cope with this kind of violence and they do not enter into any bad consequences. But if they are having some kind of elements high in their body, genetic factor is also there, overall societal issues, community related issues, family and individual issues are there, then the chances of having this violence is pretty high, especially psychological violence. Every second person, like every person or every second person, would be going through different kind of psychological violence, and could end up with serious issues like mortality, suicide, self harm, or any kind of issues and all. And then some of these studies also been conducted in Afghanistan, in Pakistan, where we have a mountainous area. So these kind of issues are really coming up from there. So it's not only societal issue, but it's more than that. Okay,
Okay.
now the second question about reporting of violence, right? A lot of developing countries are having this solution that people report. Neighborhood need to report, right? Families need to report if they come to know. If a woman comes to know that my child has been beaten by father by the grandfather. So then she will report. Even child could report, even women can report. People could report, and then whoever is reporting is always being protected, and then they get some kind of protection and something, so they do not have to go through the violent situation. However, in developing countries, we are having a lot of issues, right? So if a woman go and report, where is she going to go back? She don't have shelter homes. She don't have her own government insurance. What is she going to do? She need to go back and live with that person who is beating her, or in-laws who are giving her uncomfortable situation and all. Men in developing countries feel that they can go and live alone, but in many Muslim countries especially, it's difficult for a woman to go and live alone. It's not easy, though there are some cities where women can live alone. Like, we do have some cities in which they are more constructed in some of the countries, developed in some of the countries, but it is not true everywhere. So then one has to be very, very careful. So that's why I often say that when you are conducting researches, you cannot go upfront and say, hey, I'm here to conduct a research on violence against women, or a violence against men, or a violence against children or adolescents. I would like to conduct interviews from you. Who is going to tell the truth? No one. Everyone is going to hide their information, and we often call it iceberg phenomena, and then we would never know what is happening, right? So it's important that we should not call it kind of violence researches. We should call it women health, men health, child health, or adolescent health, because violence is a part of health. So it should be covered in that manner, and that's why ethically we have to be very, very careful that we cannot just go and become a part of perpetrator, or a part of a situation. Enhancing balance here. We do not want to have that situation, right? So we have to be really careful with that. So that's why it's not easy. And it's not easy, women is reporting. However, it's important that health professionals should be fully trained, right? Beauticians should be fully trained. 2 to 3 countries have already conducted this clinical trial where they trained the beauticians that if a woman is coming to you for wax and different kind of stuff, and you notice bruises, or if they are very uncomfortable with the situation, or they are having insomnia, so try to ask different questions to screen out if they are going through the violence. Similarly, with the health professionals, especially midwives, they are supporting women, conducting clinics, doctors, and all. So they need to ask them that why you fell, what was the reason, is everything fine with you, are you comfortable with your marital relationship, or if a men have come of with a lot of insomnia or something, one still need to ask, are you really satisfied in your marital relationship? So these things are very much important, that we have to be careful, but on the other hand, we still have to dig out what is happening in a very professional manner. And then all health professionals, the health professionals, and the sociologists who are working a lot towards that need to work. But politician commitment is very much important. If politicians are not serious about it, and they think that this is nothing, is just a part of life, then it will never be taken care of. So it's important that some different people need to be very careful what is happening. Yeah.
Right. So you kind of talked very elaborately about the topic. We have a few questions, and there's a very important question from Dr. Zishan, but I'm going to come to that. But what you said, I'm going to stress upon the point, and I want to have your expert feedback on this issue as well. But before I do that, those of you who are online, I'll request you people to please share this live feed with others, because we are generating a lot of useful information, and this topic is important. This sensitization about this topic is important, and this message should go to the masses. Uh, you said about reporting violence, right? And one aspect which I can think of, and I need to hear from you about it is when you report a violence and the stigma associated with reporting the violence, considering our cultural issues and the perceived abnormality of this act. I mean, this is not abnormal. If I'm being the abused, it's my right to report and to self-protect and provide protection to myself. But I mean, kind of a whole society will stand up against a person whether that's a man, and more likely against if she's a woman. And you kind of I mean, we have cases which are the numerous cases, people have to leave the country. They have to seek asylum in other countries. So what do you think about the stigma associated with reporting the violence in this situation?
This is extremely important, extremely important. So I will talk. I will give you different three different angles. It we can have a lot of different angles. So then let's look at the angle from the health professionals, right? Now, health professionals are also part of the society. So what is happening? That when a woman or a man or an adolescent child talking about their violence, so health professionals are also very uncomfortable to talk about it. So then they themselves try to put in kind of shelf of just like they have not seen the reality. Why? Because they themselves is stigmatizing internally to those people. If a man come up with sexually transmitted infection, they would say, oh, he must be, so if a transgender comes, he must be. If unisex come, must be, so then rather than thinking that sexually transmitted infections are there and we are supposed to treat them rather than stigmatizing them and asking them, oh, don't come to my clinic next time, I am not expert, you go somewhere else and all, something like that. So this is one angle from the health professional side. First, they themselves are not comfortable asking these questions because they're part of a society, they are not sensitized. Second, they are not fully trained to be able to talk to them, to understand, to screen out what is happening, help them out, or they think that they send, rather than thinking that probably this boy must have gone through some kind of rape. That's why he's having sexually transmitted infection. Maybe this child have gone through some kind of rape, or women have gone some kind of situation that she's having. Rather than thinking that, thinking, oh, they are just, selling the sex or doing something which is not acceptable. That's why. And then they themselves very uncomfortable talking to them, which is not at all, this is not the correct way of handling the situation. And then third, the policy doesn't allow. Many of the institutions, many of the hospitals are not happy that why the hell you are discussing this. They use these words which I have just used it because this is how they stop others, or they tell them you will be, we'll throw you out from the job if you are going to discuss these kind of things. We should not be doing it because media is baiting, and we do not want to put our feet in somewhere where media is going to like hurt us and all. So health professional side. Now second side, which is very important, is definitely media, which I have already talked about. That it's not only the society but how media is picking it up. As soon as we come to know that one cricketer, a couple started fighting, so media was discussing so much, even though they would have end up with some constructive relationship. It seems like now they can never have a constructive relationship. Destruction started, and then it's just that there is a small conflict. Having a conflict is always healthy. What's wrong in having a conflict? But management of a conflict in a positive manner is the most important. But at times media plays such a negative role in it. Media would have said that, oh, let us show you good things when they were together, they were talking with each other, they were so nice with each other. Probably that would stimulate them to understand each other, and conflict resolution is there. So this is another angle that's why stigmatization is being explained by the society and by the health professionals and by the media, right? Now the third angle is person themselves, individual. When we talk about ecological model, the individual factor, how much this person is comfortable discussing something or sharing something or saying something or adopting something. For example, a woman would say, well, for example, a man, she is appearing in one of her interview, and a man is asking a question from her, what is your marital status? She would say, well, I do not want to discuss that. So it means she herself is stigmatizing it herself. She can say, I am divorcee and I am here for my job and I have enough time and I'm capable, I can do it. Rather than saying, and she would say, no, I'm not very uncomfortable to just talk about that, can we just not talk? So then it means that she herself is not comfortable. Or a boy being raped wouldn't come and say, that it happened with me, because then he would say that entire social media will pick it up, the entire population, the entire public will, put this person at a side. Are you with me? It is also possible, if a person stand, the person would become a leader of tomorrow, isn't it? A legend of one day will come, this person would become a legend. So it's three important level which my studies have proven that we need to be taken care of. And you use such a good word, I really liked it, sensitization. Sensitization is so much important at school level, when children are going to school, so that they do not bully each other. It's so much important to become a part of professional education. Doesn't matter, people are becoming nutritionist, whatever, but one module of domestic violence or interpersonal violence or societal violence should be a part of a curriculum for each and every person to be sensitized. It's important. And then people need to talk about spaces of each other. People need to talk about respect of each other. People need to learn that you cannot just comment on someone unnecessarily at back of them or in front of them, because it becomes a part of bullying, it becomes a part of violence, which is not at all acceptable, you know
Right. So we have a question from Muhammad Ishan, which I think he is a faculty at AQ as well in microbiology. He's saying, I think we discussed this point, but if you can reiterate briefly for him, perhaps he joined after we discussed this point. He's saying that we all relate always domestic violence from male to female. What is the situation if vice versa and mental trauma come into it? So he's referring
okay,
to
yeah.
violence. Yeah, yeah. Go ahead.
Yeah. So this is what exactly I have talked about. That I have conducted two different researches, and both of the researches have identified that men is going through a lot of psychological and sexual violence from their partner. It happens, and within the domain of a home, but they are also facing a lot of violence at societal level. See what happens when there is a firing going on. Who goes out from the house to be able to check what is going on? Is this the mother or a sister or a daughter or a wife? Who goes? It's a man. Like it's a brother, son, father. They are the ones who are exposed to that kind of societal violence, right? Anything happens to the family is going down. Whatever happens, who is coming in front to be able to face? It's the men who's facing it. So they are also facing a lot of violence, but it's just different forms, right? It happens at home. I was thinking that it's not possible that a woman cannot beat their husbands or partners and all. It's not beating upfront, the kind of major beating, but it's a slight minor kind of beating is happening. And it's very small percentage. It's not a big percentage. But the biggest percentage is basically psychological violence followed by sexual. But with women, the biggest percentage is same psychological, but then followed by physical, then it is sexual violence. So this
Right,
is how it is. Yeah.
right. And what I would try to emphasize on a point is whenever we're talking about the topic of violence, it's not that one gender is like fighting with another gender. It's like a collective sociological issue which all of us have to collectively fight and get it out of our society. So that is a point passing by. And we, because in the interest of time, I mean, this is such an interesting discussion. I'm diving deep into that. But the main objective of this session was to focus on the methodological issues, because you are a public health professional, but at the same time, you are a very senior epidemiologist as well. So what I want to ask from you, that what are the methodological issues which you face on doing research on such a difficult topic?
Yeah, I think it's a very good question actually. And honestly, when I started working in this area, first time I ever thought about working in this area was 2012, not 2000, 2002. So this was the period, this was the time when I was thinking that something need to be done. A lot of, because I was conducting family planning counseling, And a lot of couples, when they were coming, and the woman was used to say that I want to have an abortion because my husband is putting me in a very difficult situation. I cannot carry this baby, so do something for me and all and all. So since then, I have started working on it. And my first paper published in the area of violence was 2005. So then, what I'm trying to tell you that I am really exposed to conducting researches in this area, and I faced huge challenges. So I will come to methodological challenges soon, but I need to share my first experience, which was ERC approval. My God, ERC approval was seems like never possible. People were saying that it is very unethical to talk about personal life. It is very unethical. So then I was not given ERC approval for complete 9 months. A baby can be born in 9 months, but I was not able to receive the approval. Each time I was getting different kind of feedback. You need to go and speak to government stakeholder. You need to go and speak to MNA. You need to find out from this. You need to take NOC from here, from there, and all. And I was just knocking the doors of different stakeholders, that is this possible? I would like to conduct a study on violence against women. Can something be done? And then everyone said, well, this is very sensitive. I said, can I use the existing healthcare system, healthcare workers? No. If you'll use your healthcare workers, so they will lose their trust from the community. They will not be able to work. That kind of messages was coming. And then it was so much difficult for me to really initiate this and get the funding and all. So local organizations were not at all comfortable to fund by saying that, what are you going to do? I still remember one of our feedback, what are you going to do with this? So then I had to explore European funding agencies, and then American funding agencies, to be able to give me some fund, to get some fund to be able to initiate this. And then when I was trying to publish local publication, I still remember I got the comment that this is a social issue. You should publish it in social journals. So this is not health related. It's nothing to do with health. And I said, but it is having consequences. They said, then only publish consequences. We do not want to see the forms of violence, prevalence of violence, associated factors of violence. So it was really a lot of challenge. So it was not easy for me to work in this area, but seems like slowly and steadily, because of sensitization in all over the countries, a lot of people started understanding what is happening and all. But it's still, and then it is still having a lot of methodological issues. Like when we talk about different formal study designs, so you cannot really enter into the cohort study designs. You cannot really see a woman is exposed to violence and another woman is not exposed to violence, and you cannot wait to look at the outcome, that let's see when is she going to develop a depression, let's see. So you really cannot conduct many of the studies, right? It is not ethically correct. Another one you can do, like you have clinical trials. When we go for clinical trials, or we are going for community trials, so you need to test the intervention to be able to reduce the violence. Are you with me? So exposure need to be given as an intervention to reduce the violence. So you need to have cross-sector study before and after, and to see that how intervention is effective to reduce it. So it's not easy. Other than intervention to reduce the violence, you cannot really test many things and all. And because it is so much sensitive, you cannot test the interventions which has which seems like not being tested in all over the world. You need to have some kind of understanding of the intervention. It will not create any harm, so you really have to go for that. Otherwise you cannot really enter it, because if you are having drug trials, you are having many other things and all, you start with the mice, then you enter into rabbit, and then you have different animals to test, guinea pigs and all, and then slowly and steadily clinical trial and all. You cannot do this in domestic violence. So it's a tough area basically to conduct researches on. The simplest thing you could do, you can go for different cross-sectional study designs, but you have to be a little smarter. Pick up your definition, like when you are saying prevalence, the prevalence should be near to incident. You just try to pick up, do not just pick up the lifetime prevalence. You can pick up the point prevalence, you can pick up violence occurred today or within 3 days, within a week, and all, so that it is near to incident rather than just saying it prevalence, and then go for higher kind of analysis rather than only calculating odd ratio. One could go for attributable risk also to be able to see how much that factor is causing the violence. Right, so one could be little bit smarter in way, and then multi-level studies can, multi-structural studies could be done. If we are saying that looking at the ecological model, it's a structure, it's a society having triggering effect, then we are saying community having triggering effect, family having triggering effect. If we are talking about all the triggering effect, the analysis should be the same. So it should be multi-level analysis, which would definitely take care of it. Another kind of study design, which I did for in my PhD also, it's mixed methodology study design. So go for qualitative also, because when we are saying the contextual, if things are so much contextual, so you need to go and find out what is happening. One of my study finding came up that higher children leads to physical violence, and this is what my odd ratio was, and such a high odd ratio, adjusted odd ratio, even in model it was the best fit, and it was having such a high magnitude. I ended up basically conducting a qualitative study to be able to understand what is the situation, why it is happening. Then I came to know, because when couple is having a lot of children, they're living in an extended family system, money is the biggest issue then, if they are not earning very well. So then they argue with each other, try to beat each other, and then this is how they are very uncomfortable with each other, and then end up having a different forms of violence. So these are some of the methodological issues. And then one more important thing is iceberg phenomena. I talked about nowadays a lot of developing countries are putting domestic violence related questions within the census we are having. It's a national level data. In level data, how can you dig out the information from the community when a lot of people are sitting over there? So confidentiality is a problem. Victim and perpetrator both are sitting over there in front of you, and then there is no building of trust. If trust is not there, how would they give you the data? A lot of information bias would chip in, right? And a lot of people would say we never faced violence. A lot of selection bias would chip in, because a lot of people are giving you false negative. They are basically false negatives. They are, and a lot of false positive might chip in if they are getting some kind of money or support. Are you with me what I'm saying? So it's not easy to conduct. It's important the entire team should be very passionate, fully developed, and they really know what is happening. Ethically, they are very sound. Even the data collector should get such a good training so that they know how to handle the situation. Because it's risky for them also. They can be beaten. It happened with one of my data collector. It was good that I told her to give me a call if you are in a trouble. I had to jump into the house to protect her sometime. So it's not easy area. A lot of methodological issues, a lot of societal issues, ethical issues. One should train themselves well before they are entering into this area. But if you enter in this area, it is going to be helpful for the victims to get rid of it. You know?
Right. So we have a couple of questions from our viewer Azra Aziz, but in the interest of time, I'm going to bring that question up in the end. Before that, as you kind of touched upon, the last point for a discussion is you talked about data collector and issues related to that. So that comes under the umbrella of operational issues related to this, because this is an extremely difficult area of research, not only from a methodological perspective, but because from an operational perspective as well, because of all the reasons which you mentioned, including the stigmatization. So the people who are doing research in this thing can also be put in danger. So what operational issues you face, and what suggestion would you give to younger researchers who want to do research in this area?
See, as I said earlier, if they really would like to work in this area, the best thing is that they should start working with some kind of mentors who are already working. They should join some of the research group who are working, like at Aga Khan University. We have violence against women as a research group led by Dr. Rosina Karmalyani, and I'm also working with her very closely. So it's important that people need to join different kind of research groups. They could join my team also if they are very much interested, or many other people are there who are working in this area. And then because this team is the combination of psychologists, sociologists, nurses, doctors like physicians, because they are the ones who will be looking at what is happening, dentists because they are the ones who will be fixing the dentures if people, you just push somebody and fall and dentures are there and all. So it should be a combination of people working together to be able to understand what is happening, develop interventions, test interventions, and then take it to the policy level. And I said it in the beginning that politicians also need to be taking it up as very, like, as a serious matter is important, because everything is connected. If a boy being abused by the friends, being abused at family level by cousins or aunties or uncle, anyone and all, this boy will not be able to perform well. At moment, our current population, most of them are adolescents, most of them are the part of productive group. If they are going through mental issues, they are going to different kind of problems, and then people are also making them uncomfortable by thinking to it must be fault in yourself, victim blaming, the person who is victim being blamed also. So it's important that we need to give attention to work. We need to have budget to be able to work in this area, to be improve it and all. We need to have budget to develop the consortium in this area so that people from all over the world could work together. It's important. We have consortium money available for many other things. Right now, everyone is thinking about COVID, but COVID have also the situation. The COVID have worsened the situation in a sense that now people are in lockdown situation, so they do not, they cannot practice their own spaces. They do not have any coping strategy to go out and walk and do many other things and all. So they have to tolerate each other. If they are uncomfortable with something, they would burst out. And then what is going to happen at the end? That a lot of beating and those kind of stuff would end up. And I think dentists also need to conduct some studies to find out how many dentures are being destroyed. Orthopedics need to conduct some studies to find out how many orthopedic fractures are coming up, in their hospitals and all. So many other, they have to be little bit more alarming with that. One more operational issue which I talked about in the beginning, that no one is ready to work in this area because they think that nothing can be done. That's not true. One of a study being conducted by just placing one flyer on a wall in different places, and with that flyer, the percentage of psychological, physical violence went down. It reduced because of that. Why it reduced? Only with one flyer. So people were so much sensitized. If people come to know that someone is watching them or someone is there to support, so then people would be careful. 25% reduced there and there, rest 25% will be reduced with some more interventions. And it can become zero. We have a policy, but are we really enforcing that policy? Are we really applying that policy? Those kind of things need to be done. Have I
Right.
missed out anything?
Yeah, sorry. Go ahead.
Have I missed out anything?
No, I think this was quite comprehensive, and I would like to mention to our viewers that this is something which you will rarely find in the epidemiology books. This is something which is coming from the real world experiences, and not something from, and it's the meat of the years and years of research work. We have a number of questions. I think it's time for us to go into these questions. First of all, Azra Aziz has asked what the government should do to support the affected persons. But before we go into the answer to this question, my point to everybody who is watching this is that, first of all, this voice should reach to the government. And one way to do that is to share this particular feed or raise your voice whatever way you can. There is a lot of negative information on social media. One of the reasons I started this channel was to see all the nonsense being spread about using social media for all the wrong reasons. We have this tool, we can use it for some positive purposes, and this is one of them. So my request to you is to please share this live feed and this video to others, so that this voice can first reach to the government, and then we can ask the government that, okay, these are the senior policy makers and these are the senior professionals, these are their recommendations, and now you need to act on that. And with that comment from my side, I will And I will ask Professor Tazeen the question that what the government should do to support the effective these people.
See, it's important. Government need to do three things, right? First, they should allow, or they should first. I would why I'm saying allow, because a lot of people are trying to have what I'm going to suggest now. And second, those who don't have, it should be a policy of it. Policy of it. As I said earlier, that domestic understanding of domestic violence, respect, space, those kind of stuff could be a part of our curriculum. It's important that young children should start understanding what is happening. Beating is not acceptable for women and men both, boys and girls both. Bullying is not acceptable, those kind of stuff and all. And then some of the policies which we are having right now, that if anyone is going to do that, they will be entering into a serious punishment. They will not be forgiven, or no one is going to ignore that. Doesn't matter. It's a child of a president. It's a child of a MNA, a child of a teacher, a child of a surgeon, a child of a nurse, or a child of a housemates. You know, when we are having housemates and all. So whoever this person is, if they are going to destroy any policy at school level, they need to face percussions. They need to face that. Children, if children will start learning it, then it is much easier for them to continue the behavior because they are the ones who are learning. Then adolescents at university level, it's important. It should be a part of curriculum. Nutrition is a part of curriculum. In Pakistan studies, history is a part of curriculum. Why not domestic violence is a part of curriculum? It's important. It should be there. People need to understand that this is something which is not acceptable. Why only lawyers need to study this? Everyone need to do it. Doctors in their curriculum should study it. Nurses, midwives, nutritionists, pharmacists, all the anyone, the people who are studying textile, everyone need to study this. It's important. So it should become a part of a curriculum, and the policy should be there. If anyone is not covering it, they cannot move with it. They cannot run their institutions. Like we are having so many higher education policies and all, and everyone really have to follow that. So similarly, we need to have these kind of policies. We need to follow it. This is the biggest role of a government, of developing a policy and enforcing for the implementation of the policy. Two things should be there. So these two things, and third, definitely, it's important to keep some kind of budget. You know, it's important. So much of budget is there for different kind of diseases, issues, and all. But this is the biggest problem. If because if people are not healthy, people are not performing what they could do it, how would we build a society? It's important. Some budget should be there to be able to go for implementation researches or community trials or clinical trials where we could test good interventions to be able to enhance a better practice and quality of life of a people and those kind of stuff and all. So I think at government level, if this is done, and the fourth and the most important one, government should also place a rule. We are having a lot of rule on media also. That's something they cannot really talk about. So they should also say that they should not stigmatize anybody um, uh, uh, for being the victim of anything. It's important. We cannot really blame the victim. But at one angle, they are being victim, and we are putting blaming them, and then they are the ones who will go and perform self harm. And then we always have nature nurture debate. You understand that, right? So even though they are having generic influence, even though they are having a lot of metallic problem in their body, or new elements and the compounds in their body due to any reasons and all, but if society would support them, if the nurture will be supportive, they are not going to have any issues. And we epidemiologists believe this very strongly, that they will not have those issues.
Right. So the next question is from Shalanaim Zafar. She's asking that Shalanaim, just want to know that can we include policemen or women in the team? And I think she means about the team of your research team. So what do you think about
Sorry,
this? So
my
she,
research.
yeah, she's saying that you said that you have multidisciplinary team which is working on this issue, and she has just suggested that her name is Shala Naeem Zafar, and she wants to know that can we include policemen and women in the team which we are working on. I think this is a good suggestion. What do you think about it?
One of a study which I conducted, it was conducted in rural Sim, and then when we were entering, a lot of people actually supported us. A lot of stakeholders supported us, but to because we all know that people could be under risk, so we really wanted to give protection. So then we visited some of the police department, women police department, and they were so much supportive, and they read the law, they knew the law, they understood very, and they said that if you guys think that you are under trouble, so keep these phone numbers, you can contact us. So we did that. We research team handled it so well that it was not necessary to call them, but women police were very supportive, and if they are part of it, it's very much important. In my in my one study, where I collected the data of from about 700 people, two women like faced some kind of serious issues, being beaten by the entire family due to some personal reasons. So then we really had to contact the police department, and that police inspector was so much supportive. She came over, she talked to the family, and then one of them provided a shelter home also. So what I'm trying to say that they are getting a lot of training, they are fully trained, they understand the problem because they themselves are women, and they can understand the context, the overall context, what is happening. So they are very supportive. However, some of them need to study a little bit more, and it is only possible if it becomes a part of a curriculum for each and every even at constable level, rather than only higher level of stakeholders, or at inspector level or sub inspector level. They are the ones who are studying this and aware of it. It's important everyone should be aware of it so that they could support. So the answer is not to start putting anybody in a prison, but the thing is that they should become a part of part of managing conflict in a positive manner, what earlier I talked about. And they could do it. They're very highly educated people. They could easily do it. The best thing is that people are respecting a lot the police and army, all of, authoritarians and all. If they become a part of it, the system could improve a lot also. So we all have to work. We all have to work together. So it's a very good point. Thank you,
Right.
Shella.
So we will entertain one last question because of the interest in the topic. Our session has gone beyond 1 hour, which is quite good. But we have also been respectful for the time for our speakers. So this is the last question which we are going to entertain. It is again from Dr. Zishan, Dr. Muhammad Zishan. He's asking that what is your opinion about the trends of domestic violence in Pakistan? Deteriorating social values might be the risk factor, and that is question. That what so there are two aspects to this question. What do you think about the trends of domestic violence in Pakistan? Are they increasing or decreasing? And what are the risk factors? Are they deteriorating social values the risk factor or not?
Yeah, I think both of the questions are very good. And as I said earlier, that the commonest form of violence for men and women is psychological violence within the home, right? And then followed by physical violence and sexual violence for women, and then for men followed by the sexual, and then afterwards physical violence at the end. Sexual violence not in the lighter tone that I'm saying that, oh, look at your body, you are not muscular, those kind of stuff, and putting somebody down and making uncomfortable about their body and those kind of stuff and all. So this is what I have identified with my multiple papers published. I think so far I have published more than 25 papers in different journals, and this is what the summary of the overall finding of the prevalence. The overall study, which if you go for conduct by utilizing the health professionals or data collectors on whom communities trusting, you get to know a lot of high prevalence of physical, mental, psychological, emotional and all. But if you just go there as a very kind of person, you don't care about anything, you say, oh, I'm just a researcher, I have to conduct a study. So you might not be able to capture all the different form of violence. And other important thing which I would like to talk about over here, that rather than saying that is your husband beating you, is he giving you sexual violence or psychological violence, one need to come up with the indices. So come up with the indices is the way WHO questionnaire is talking about. So then WHO is giving some kind of indices. With the help of indices, you can develop the overall outcomes after social psychological, right? So this is what, so pattern in Pakistan honestly was very high. And my study showed that psychological every second woman, physical violence is every fifth woman, and sexual violence is very like very eighth woman or 10th woman are having sexual violence. And then for men overall psychological violence is in 90s, very high. But the physical is very low. It's just 1 in 100 is having the physical violence, but sexual violence is 2 in 100. You would say that this is what is happening, but psychological violence is very high. Like every second man, or you could say every third man is having some kind of psychological violence. So this is it. Now, factors responsible for, as I said earlier, if you just use the ecological model, you could understand the factors. If we just look at the societal factors, that's policy level factors, norms, issues, and those kind of stuff. Like Dr. Amir said it in the beginning that it could be it could be the overall societal understanding of gender roles. So men should act like a macho. He should go in front, even though his heartbeat is so high and so much afraid himself, but he is expected to come in front. So even if any within the house some arguments are going on, men, it seems like, people say that he's the one who will handle everything and all, even though he doesn't know how to handle it, right? No one have trained him. People have rather trained him to be more aggressive. So and you know that this is a fair phenomena. If you are afraid of something, what are you going to do? You will raise your voice, you will start shouting, and this is what is happening at the end, right? And then when somebody is raising the voice and start shouting, so become little bit hyperactive. With hyperactive, you might push somebody, and that the somebody, if it's a woman, definitely she will end up with a fracture, right? So this is a kind of the phenomena of the situation. So these are all societal factors. Then we can talk about community factor. Every community act differently. One of my colleagues said it just now, that higher the situation high in the mountain is different. Situation in Gilgit is different, Chital, Swat, Mardan. If we just look at all those high in the mountain, situation is very much different. Even in Afghanistan, some of the mountainous areas are very high, and the situation is different. So community factors are always important and need to be taken care of. And then family factors, how much autonomy everyone is having to take the decision, whether the decisions are joint decision or separated out decision. What is the gender discrimination gap over there? How much gender equality being given to everybody and all, and there is to get respect and all. Maybe one of a person is being victimized, and then because one person is not powerful, all powerful are putting the pressure a lot and all. And then sometimes it happens that people try to become a part of a powerful people within the house also, and then others left behind, so it's important that if one person is powerful, that person should give power to others also, so that it's a family. It's they are living in a system where they feel comfortable, where children are being nourished and all. So then it's important that we need to give focus, we need to pay attention a lot in our within our family system, and we need to pick up the respecters and individual factor. Like you and I would be handling the situation differently. So then if we are handling the situation differently, whatever it is, absolutely fine. We do not have to wear a uniform of intervention to cope with the situation. But whatever it is, it should be positive and productive. So risk factors of that area should also be identified. Otherwise, it's incomplete.
Right. So I think with this we'll end our discussion because we are past 1 hour and it's like approximately we're approaching 1 hour and 15 minutes, which is quite a lot of time for a speaker to be talking continuously. We are really thankful to you, Professor Tazeen, for taking us a time for us at this late hour and talking so enthusiastically about such an important topic. And what I will end with a request to all those who are watching is, uh, we often say that there are many problems with it, but whensoever we request people to do something about it, the sad reality is that even we do not get a lot of positive response, even if it is, if that doesn't require a lot of effort. For example, sharing this video will not require a lot of effort. Additionally, what I will also see that the first step, what I will also say, the first step in solution to this problem is the acknowledgement of the fact that this is a problem. It is a surprising reality that how many of our professional colleagues still do not recognize that this is a very, very serious problem. We need to acknowledge the fact, first of all, and be insightful of the phenomenon that this is an extremely serious problem, and we are, and it's a matter of shame how much prevalent this problem is in our society. With that, with the request to please share this video with your colleagues, and if you have not subscribed to our channel, please subscribe to our channel. Do not forget to press the bell icon, and if you have more questions, you can keep putting them in the comments. If we see that there is a lot of unanswered question, we can also arrange another session with the consent from Professor Tazeen. And with that, I'm once again extremely thankful to Professor Tazeen for giving us time from her busy schedule. Take care, everyone. Bye for the time being.
Thank you, Dr. Amir. Take care.